Everybody, happy Monday, our favorite day of the week because we get to meet here on our Learn with Flo. Welcome. If you are new here, I am Lauryn Moore, a functional nutrition practitioner. And I'm really excited to continue our series here as we talk all things functional fertility. So I like to really kind of pick a theme of the month lately and do a nice big deep dive in it. I think we're just in a culture right now where we have so much just like quick soundbite, right? And obviously that's not a great way to disseminate all of the nuances of some of these topics, especially in the world of healthcare, right? And when it comes to understanding our body and our metabolism and hormone balance and gut health, it's just, we can't always get all of the nuances out in like a 3-second soundbite. So I love these Learn with Flo sessions for us to really be able to do a deeper dive into each of these individual topics and talk about it really from all angles and kind of dissect it. So whether you're a patient in the space, whether you know somebody that is interested in supporting their hormones or their fertility, I think it's pretty common that most of us might know somebody or some couple in our life that has either struggled with fertility in the past or is currently struggling with fertility. And this is going to be for you. Today, I specifically want to talk to my fellow practitioners out there who may be working with individuals through a fertility journey or even just a health and hormone journey, because it all fits together. Even if this concept of fertility doesn't feel like it applies to you right now in this season of life, I think fertility is just one of the glaring examples of how we're seeing some of the gaps in our conventional or traditional understanding of fertility, and also some of the major gaps in then the conversations that are happening in some of these appointments and offices. And therefore, if we're not having the right conversations, then we're not asking the right questions, and then we're not getting the right tools, right? And this fertility conversation, I just can't emphasize enough how it's really just one of many examples. This pattern does not just apply to fertility. It applies to all areas of kind of our modern healthcare system, and where I'm really excited about being on the forefront of building something new and building something different, because a lot of people are finding themselves, falling between the gaps. And let's just say that, right? And fertility is one of those many examples. So if you've been with us, throughout our journey, where we're really blending science and soul and we're exploring root cause medicine in a whole new way, then you are in the right spot, okay? And with our fertility series, we really have been talking about the differences between a conventional and a traditional understanding of fertility, knowing that conventional medicine is really like, how can I get you pregnant? Whereas functional methods are more, why can we not get pregnant naturally? What is standing in the way? What are the barriers in the way that are telling the body that it's not safe to feel fertile right now, right? And so we really talked about that, the differences between some of the conventional approach and more of a functional approach. We also dove into some of the truths behind really supporting egg and sperm quality, looking at things like mitochondrial health, which then led us into conversations last week around the importance of preconception care, especially when we think about this post-pill birth control hangover that I really see. And I really just talk about this post-pill birth control hangover in the sense of, what are the resources that females that are coming off of birth control aren't getting? What are the conversations that we're not having about the importance of different aspects of preconception care? What are the things that we should be doing and supporting with our bodies even before we think about getting pregnant? And it's not just the seamless transition of immediately stopping birth control and then jumping into a pregnancy journey. And what are some of the risks that are involved in that, right? Full-fledged, just transparency of information, that's what I'm all about. So I want to apply that then to today, where I want to kind of bring our series full circle, specifically being able to talk to fellow practitioners in this space about the 5 critical fails that I am starting to see in more of the functional fertility space, things that we're missing, things that we're overlooking, things that we're not putting enough importance on when it comes to helping individuals and couples that are interested in supporting their fertility or are struggling with fertility. So today I'm going to really talk about the 5 most common and even the 5 most costly mistakes that I see, even functional practitioners, even fellow people that aren't even in the conventional space, they're practicing more of a root cause medicine. Even then, there's a lot of nuance between how that practitioner may be viewing their overall thought process and treatment plan for somebody. And I kind of want to, like I said, pull back the curtain there and talk to my fellow practitioners out there so that we can kind of audit our own practitioner skills and our own clinical medicine to make sure that we aren't falling into one of these traps. And if we are, then we can start to kind of like see a little bit of a different path or maybe a higher level way to look about supporting more of a functional fertility method with our patients in clinic. So trust that the future of women's healthcare just deserves way more than our guesswork and some cookie cutter protocols. So that's what I'm all about. I see that way too much from a functional medicine standpoint is just the same thing from a conventional medicine standpoint, a supplement for every symptom and some cookie cutter protocols, cookie cutter diets. And that's not what we're about because that's not what works. And there's still people that struggle. So let's just jump right in. No additional introduction needed. What are the 5 biggest fertility fails that I'm seeing in the functional fertility space? And number 1 is overlooking the gut and fertility connection. Okay. This goes far beyond just asking about, are you bloated or are you constipated, or even just goes far beyond running a GI map test or running some microbiome testing. Most fertility focused practitioners know that gut health matters, but most of them, in my experience, they aren't accounting for really the full impact that gut-derived inflammation or even immune dysregulation has on their patient's reproductive capacity. So again, this is where I'm seeing in the functional space where individuals are maybe going into a functional provider or a functional clinic and they're expressing concerns about hormone issues or fertility concerns or preconception care. And that provider may have a really good knowledge about the connection between hormones and gut health. But what happens is they might run the same stool testing that they run on everybody, and then they give them the same kind of cookie cutter protocol that they give everybody. A probiotic, a prebiotic, maybe some fiber, and like kind of just running maybe some L-glutamine, right? And just like a very cookie cutter approach that everybody gets. And I'm like, that's not gut health. That's not a gut health and fertility connection, because what we might be missing with those cookie cutter protocols, even if you're running a GI map test, it's like we might be missing some really important things. Like what about even like leaky gut? We have these very potent gram-negative bacteria in the gut that are called lipopolysaccharides. And again, my fellow practitioners in this space, you might be familiar with some of these terms. If you're still kind of gaining your clinical knowledge and gaining your clinical toolbox, this will be helpful for you to kind of have some of these terms under your belt. But we think about these lipopolysaccharides, or sometimes they're abbreviated LPS. And when we see these LPS or these gram-negative bacteria in the presence of a leaky gut, we get this translocation of this bacteria actually out of the lumen of the gut and into the bloodstream, okay? This is a process that we call endotoxemia, right? So we have these lipopolysaccharides, we have this leaky gut, we get this endotoxemia. So we get this whole dysbiosis and leaky gut situation is going to signal some very potent inflammatory responses in the immune system. Things like TNF alpha, things like interleukin 6, like we're going to directly suppress ovarian production of eggs and maturation of eggs. We're going to get a suppression of ovulation. We're going to get a suppression of the follicular phase being able to fully develop. So we have to understand that, like, yeah, you can run a GI map test and you can say like, oh, I'm a provider who understands the gut fertility connection. But are we taking into account like full immune dysregulation that might be happening from this dysbiosis and this leaky gut? Are we also taking into account things around the overall microbiome that impact things like estrogen? There is a whole aspect to the gut microbiome called the estrobolome for a reason, right? We see estrogen interacting with the microbiome. So we know that gut microbiome actually alter estrogen metabolism, especially through this particular enzyme called beta-glucuronidase, which you can measure on more of your GI map testing, and we can see firsthand what's the relationship between what's happening in the microbiome and that female specifically, or even a male. What is their ability to actually detox estrogen? Are they estrogen dominant? Do we have impaired hormone clearance pathways, right? That is not something that a cookie cutter GI map protocol of some probiotics, prebiotics, and some glutamine, like that ain't touching this picture. So we have to make sure that we're taking a deeper look, or even looking for some of those more deeper gut infections or gut pathogens or candida overgrowths or SIBO that contribute to things like food sensitivities or cross reactivity with ovarian tissue and can trigger things like autoimmunity, right? So it's just, we have to recognize that the fertility fail number one that I'm seeing with functional providers who mean well, but they may not have the full gamut of information of how the gut actually impacts reproductive health and reproductive fertility. There was a 2020 review in the Journal of Reproductive Biology and Endocrinology that I wanted to share with you guys. They note that dysbiosis, which is an imbalance between the good guys and the bad guys in the gut, and increased intestinal permeability, which is a fancy way of saying leaky gut. So an imbalance between the good guys and the bad guys and a presence of leaky gut are emerging contributors to PCOS, endometriosis, and even reoccurring implantation failure. So if we have these couples that are going through IVF treatments or going through IUI treatments, and it's like they're having failed implantation, like these are things that we need to be considering, right? Like this is not just like, oh, this is a cool woo-woo alternative to medically assisted fertility methods. It's like, no, this is absolutely the work that needs to be done before some of those methods will even work. So why are we kind of allowing couples to just ignore this gut fertility connection? One, there could be potential for them there to conceive naturally if we know how to actually overcome this barrier. And two, even if they do decide to pursue medically assisted fertility technologies, that's great, that's grand. It's actually going to work better, right, than having failed attempt after failed attempt after failed attempt, because there's some underlying gut and inflammation issues here that were preventing them from conceiving naturally and is also preventing them from conceiving with medically assisted interventions as well too. So what should we do instead? Yes, we need to be inclusive of GI testing, but we need to make sure that we're also taking into account things like histamines, things like secretory IgA status, things like these lipopolysaccharide markers, and also really a deeper gut workup and not just these cookie cutter kind of protocols. Because I see so many people that like they just, yeah, we know the gut is a thing, but they've really only been handed, like I said, cookie cutter template medicine, and it's just not cutting it. So functional fertility fail number one is not fully understanding the intricacies of the gut and fertility connection beyond just a basic cookie cutter protocol. Oh yeah, they told me to like give up gluten and they gave me a probiotic, a prebiotic, and some glutamine. I'm like, yeah, that's cute. Like you can get that off of Google, right? It's like, that's not the gut fertility connection that I'm talking about. And some couples really need that. Functional fertility fail number two that I tend to see is closely related to the gut stuff, but not considering the total toxin burden. Okay. If you followed any of my stories or my latest reel, I posted a reel yesterday that really talked about how the toxin conversation is sometimes like dubbed like woo-woo, or kind of dubbed like, oh, your liver and your kidneys should take care of toxins. And it's like, no, you're not wrong, right? That's between urine, stool, and sweat are major pathways that our body gets toxins out of the body. But a lot of practitioners, even in this space, they kind of stop asking about like maybe their entire conversation around toxins is like, oh, don't use plastic water bottles and ditch your scented candles. It's like, cool, yes, that's great. That's a solid start. But like, these things are everywhere and they bioaccumulate in the body. And also, let's be real, there are certain genetic predispositions that make someone a crappy detoxer. Maybe we don't realize that this is an individual that's coming in for fertility issues, but actually they have mycotoxins that are impacting their mitochondrial health and affecting follicular development. Or they have a glyphosate buildup in their body that disrupts things like estrogen production and it causes all of this oxidative stress in the ovaries and the testes. Or we're seeing heavy metals like lead and cadmium are directly linked to IVF poor outcomes and poor sperm motility. We're also seeing things like forever chemicals, which are found in a lot of synthetic clothing and things like that, non-stick cookware, and they're directly associated with delayed conception and miscarriage. So it's yes, these toxins are everywhere. You're not wrong. But for us to just ignore them because they're everywhere, it's they are bioaccumulative. So they accumulate in the body. And a lot of times we're not, like I said, paying attention to how much are we supporting this individual's detoxification pathways before they try to conceive, or support their detoxification pathways before they try medical interventions like IUI or IVF. There was a cool study from the Harvard School of Public Health that found that women with the highest levels of some of these forever chemicals in their body had a 40% lower chance of pregnancy compared to those at the lowest level. And these women were in their 20s and their 30s, peak reproductive cycles, right? So we know that a lot of these different environmental exposures, some of them are, like I said, more like molds, heavy metals, pesticides. Some of them are found in more of your endocrine disrupting chemicals and fragrances and things like that. It's yeah, we're going to be exposed to them. It's not about reducing the exposure quite as much as improving our own body's detoxification pathways. So maybe we need to think about supporting methylation. Maybe we need to think about really supporting their detox pathways with targeted liver love and lymphatic support before we even talk about this conception prep, right? So not considering total toxin burden, that to me is a functional fertility fail for a lot of people and a reason why a lot of couples kind of continue to struggle. Number 3, functional fertility fail is only looking at the female side of things. I don't need to belabor this one too much because I think more and more research is coming out around us understanding that it's just as much sperm health as it is egg health, as it is both the sperm and the egg being able to come together and create a healthy pregnancy. So you kind of hear the statistics of 33% males, 33% female, 33% of both of them coming together. It could be any one of those, but unfortunately, I feel the female side of stuff, that tends to get a lot of the blame and shame game, which then carries a lot of stress for the female. Some of the things we are probably missing from the male side of things is poor sperm morphology, which is the size and the shape of the sperm, as well as things called DNA fragmentation. These are actual tests. Aside from just running a basic sperm count, which, let's be real, the threshold for what is considered good is considerably lower than it was even 10 years ago. So we're just continuing to lower the bar and checking off the males and being oh yeah, you good. And it's no, 10 years ago, that number would have been clinically low, but we're just allowing it to slide now because sperm counts are just dropping overall. I'm no, I don't want to be compared to the average sperm counts. It's we want to compare to what is optimal, and also being able to look at the sperm morphology and the DNA fragmentation, because we see how that relates to early miscarriage and also implantation failure as well too. Most of our semen analysis is very outdated. It's using World Health Organization reference ranges that allow for severely suboptimal parameters to be labeled as normal or acceptable. So I think, like I said, we really need to look at the male side of this too. It plays into a lot of the same things like mitochondrial health, toxin exposure, metabolic health in men. Men, are we getting a workup for things like high sensitivity C-reactive protein, insulin resistance? It's guys, you got to do your part too, right? This isn't just a one-sided transaction, right? So there was actually a 2023 study that concluded that routine semen analysis fails to identify up to 30% of functional abnormalities in infertile men. So that's kind of like just gives you a statistic there of how much we're missing when it comes to like actually looking at comprehensive semen analysis, but also not just semen analysis, but also the entirety of their metabolic health. If they are practically pre-diabetic and they have insulin resistance and they have high inflammatory markers and their liver enzymes are off the charts, it's like, okay, you have just as much work to do as we look at from a female side of things, and maybe even more work to do in that side too. Functional fertility fail number 4. So we've already visited like number 1, not connecting thoroughly the gut and fertility. Number 2, not addressing in total the total toxin burden. Number 3, only looking at the female side of things. And number 4 is ignoring the role of stress and the nervous system, right? We love to hate this conversation because 1, it's so powerful, which is why we love to have this conversation. But we hate it because stress gets such a bad vibe, such a bad connotation. We kind of throw it into the pile of like, yeah, okay, tell me something I can actually control. And stress actually does have a lot more of those biochemical potent disruptions to the entire fertility cascade than sometimes we even give it credit for. So cortisol, our main stress hormone, directly inhibits that HPO, right? We think hypothalamus pituitary ovarian axis, or even how the brain communicates with the testes as well too. So we know that cortisol directly inhibits and suppresses and blunts things like ovulation and overall sperm production. We know that chronic stress reduces progesterone output. It impairs implantation. It gives us like a lot of that more luteal phase symptoms for women, which is part of our overall progesterone and part of our fertility, right? So we know that stress is a thing. It's definitely part of this picture. And whether it's past traumas, whether it's overall defects in our overall fight or flight, we're not able to shut off that fight or flight system and actually get into rest and digest. We have trouble with creating boundaries for ourselves. We have perfectionist patterns. All of these can create a state of like nervous system fight, flight, freeze. Even when your labs look completely normal, it's this underlying energy that all of the cells of your body actually feel. And just to throw out some statistics for you guys, the higher your salivary cortisol, we see that it takes 29% longer for a couple to conceive naturally. And those couples had twice the rate of overall infertility. So thinking about like the power of our thoughts, our beliefs, our nervous system, stress, controlling what we can control, that is a huge part of the overall fertility conversation. And again, I don't think that there's enough actual nuance. Like we might mention like, oh, reduce your stress. That's not helpful. Like we have to actually, as practitioners, have tools in our back pocket that are specific to help people understand the role that their nervous system is playing. So I love helping patients track their HRV or their heart rate variability scores. So if they wear a wearable device like an Apple Watch or an Oura Ring or a Whoop band, it's like, are we as practitioners having them like actually pull up their Whoop data? And it's like, let's take a look. Let's look at your HRV. How are things trending and tracking? That's going to give us like some hard, steadfast data to show them like, hey, your body is in a chronic state of fight or flight on a daily basis. And I think that this nervous system regulation is probably playing a really big part in your guys' overall fertility journey right now, right? So even type A clients who say like, I'm not stressed, it's like that like actual HRV data can be a very good objective marker. There's lots of different tools out there, lots of different vagal nerve stimulator devices, like a Pulsetto device or a True Vega device, or even like prana mats, Heart Math Institute. There's so many specific ways that we can kind of direct our patients towards some of those, but even some of the simple freebies of like breath works and meditation, like those types of things are very, very beneficial too. So making sure that we're working with our patients to help them understand that, like, no, this is a thing. This isn't just like, oh, a cute thing that I mentioned at the end of our time together of like, oh yeah, don't forget about stress. It's like, this actually sometimes is the homework. It's like, it's not like more supplements and more gut stuff and more detox work. It's like, no, your homework is to really figure out like where you can create some better boundaries and really start to foster a better nervous system regulation. Like, that's the homework. Functional fertility fail number 5, our final one here, is expecting quick results and expecting pregnancy too soon. Again, I think part of this is also kind of fed in from our conventional medicine system, who tells women like, oh yeah, when you're ready to get pregnant, just stop taking your birth control and you'll be all good. It's like, okay, well, what about the females where they're still trying 3 months later and 6 months later and 9 months later and 12 months later? It's like, they think like, oh my gosh, I'm broken, something's wrong. And I'm like, no, nobody just talked to you about what actually needs to happen for preconception care after you come off of birth control. Like, I wouldn't be shocked if a female doesn't get pregnant right away. And in fact, I wouldn't want a female to get pregnant right away, right? It's like, no, we want to give your body at least 90 days. If we can get 6 months, if you can give your body 12 months of just prepping you as a human to take care of your needs and to fill your gaps and fill your bucket before you have another human who is literally leeching on all of your vitamins and minerals and proteins for the next 9 to 12 months between pregnancy and breastfeeding, let's do it, right? So we're kind of not setting our clients up for success if we expect to conceive within the first 1 to 2 months of doing some of this work. It's like, you are unintentionally mirroring the very problem that you're trying to resolve with conventional medicine. You're kind of feeding into the narrative of like a reductionist, symptom focused care. Instead, we need to kind of, like I said, lay that precedence of like, no, we're just focusing on you as individuals and you guys as a couple for the next 90 to 120 days. Like, we're going to influence like egg and sperm quality all the way to like stem cell and maturity and mitochondrial health. It's like, let's really build and foster this phase 1 preconception support, which includes things like clearing out any dysbiosis, opening up our drainage and detox pathways, regulating cycles, recalibrating the hypothalamus pituitary gonadal axis, which, like I said, all of this work, that's 90 to 120 days of work. That will probably put our fertility timeline a few months down the road, but this build phase is like going to make that process so much easier and so much more of a positive experience for everybody, so that no one's going into pregnancy or postpartum like already depleted, which increases your risk for pregnancy related complications or even postpartum complications like postpartum anxiety, postpartum depression, things like that as well too. So not all improvements are linear. Clients may see, like I said, temporary setbacks and things like that as the body reorients, but these are the things we really have to set up their mindset for success, because even the International Journal of Environmental Research and Public Health in 2021, they put out their recommendations of at least 6 months of preconception detox and metabolic optimization for healthy fertility. So 6 months, right? That's what the research is saying. Are we always following that from a conventional medicine standpoint? Hell no, we're not, right? But knowing that that is actually there and those guidelines are put out for a good reason just gives us a pause to kind of come back to that is very enriching for a lot of couples. So if you, like I said, work in this functional fertility space, and doesn't have to be specifically fertility. I definitely don't advertise myself as like a fertility specialist, but by getting someone more metabolically healthy, helping them really come to a more balanced place from gut health and detoxification, removing any of those potential barriers that their body has in the way of them being able to conceive naturally, not only do they feel better as a human, but it also makes people more fertile. I can't tell you how many times the work that I've done with individuals, they're like, well, fertility wasn't even really on our radar, but now it is. I'm like, yep, surprise, like you're way more fertile when you're more metabolically healthy, right? And so there's so many people that I think are kind of bypassing that knowledge and going straight to like, how do I force pregnancy? And then we're surprised when there's more pregnancy complications, there's more postpartum complications. And I'm like, yeah, I'm not surprised, right? That lines up. We literally like forced when the body was telling us like, I'm not ready for one reason or another. It could be consciously or subconsciously. The body wasn't ready and we try to fight that or force that. We can't act surprised when there's more complications along the way, right? So if you're going to work in this functional fertility place, we have to recognize that it comes from a way of like removing the barriers, bringing that body back to that feeling of safety and see how it responds naturally on its own as well too. So if you're a patient and you're kind of curious, like I said, about this world and you want to start your own journey towards more of your natural hormone health or dig into some of those barriers that you suspect are there, that's where my functional wellness consult will be perfect for you. You can head over to the link in my bio, schedule that consult and kind of get started into my world right away. If you're more of a provider in this space, check out my website. I have a link to my mentorship program. It's a 12-month provider mentorship program where we dive into all of these types of things and more. So lots of resources for everybody. Hopefully you guys enjoyed this series. We'll be back next month with a brand new topic to really dive deep. Enjoy your week.